Atrial fibrillation, or AFib, is the most common heart rhythm ailment in adults. Several million people in the United States live with AFib at any given time. Dr. Christopher Bauer, a cardiac electrophysiologist at SSM St. Mary's and St. Clair Hospitals, specializes in the treatment of heart arrhythmias such as atrial fibrillation.
It's an irregular heartbeat that's associated with rapid beating of the upper chambers of the heart, or the atria. The heart has 4 chambers, 2 on the top, 2 on the bottom. The heart chambers on the top are called the atria. They essentially serve as collecting chambers, so they collect the blood either from the body or from the lungs. And then the lower chambers are the main pumping chambers of the heart. The right lower chamber of the heart pumps blood out to the lungs. The left lower chamber of the heart pumps blood out to the brain and the rest of the body. Atrial fibrillation is really a problem with the upper chambers of the heart, and that in turn can cause the lower chambers of the heart to beat irregularly. This rapid beating can cause a number of problems. Because the heart is beating rapidly and irregularly, can form blood clots in the upper chambers of the heart. Those can potentially break off and cause a stroke or other serious problems. The other risk, particularly in patients who don't have symptoms with their atrial fibrillation, is that their heart rate might be very high for prolonged periods of time. And over time, that can actually weaken the heart muscle and cause congestive heart failure.
Well finished.
There are a number of risk factors associated with developing atrial fibrillation, including high blood pressure or hypertension, diabetes, congestive heart failure, obstructive sleep apnea, and a variety of other conditions that can predispose you to developing atrial fibrillation or AFib. But why some people develop it and other people don't, we really don't completely understand at this point. The symptoms associated with atrial fibrillation can be quite varied depending on any individual patient. Some people don't notice it at all, and it's only incidentally discovered when someone checks their pulse or checks an EKG. Other people have very severe symptoms, including shortness of breath, severe chest pain, inability to function and carry on activities of daily living. To diagnose atrial fibrillation, we have to catch it when it's happening, and that can be sometimes tricky. Some people are in atrial fibrillation for long periods of time, and we can catch it on an EKG or other type of heart rhythm monitor that we would have you wear as an outpatient.
The treatment for atrial fibrillation typically begins with medication. Treatment starts with reducing the risk of blood clot through medications such as aspirin, warfarin, or Coumadin, or newer anti-blood clotting medications that have recently come on the market. Next, symptoms are treated using heart rate controlling medications, including those commonly prescribed for blood pressure and other heart problems. Finally, it may be necessary to use antiarrhythmic or rhythm controlling medications to suppress the atrial fibrillation. If these treatments are not effective in controlling symptoms, or the patient can't tolerate the medication, then ablation may be considered.
Ablation is just a term that describes finding out where the abnormal rhythm is coming from and destroying that abnormal area of the heart that's responsible for the atrial fibrillation. We can do that in a variety of ways. There are some approaches that we can put catheters or wires up into the heart through the blood vessels, map the heart electrically to see where the abnormal rhythm is coming from, and then selectively burn or freeze the areas that are responsible for the abnormal rhythm in order to get rid of it. The burning technology, or radiofrequency ablation, has been around for quite some time. It's a proven technology. It's probably the most effective technology in terms of success rate for a catheter-based ablation. However, there are some areas of the heart that are very close to critical structures that we don't want to damage, and the heat-based ablation or burning technique can sometimes inadvertently damage structures in those locations. For that reason, we sometimes use the freezing technology, which is less likely to damage critical structures in the heart, but it's also slightly higher risk of recurrence of the arrhythmia.
As an electrophysiologist, Dr. Bauer is a cardiologist with additional training in heart rhythm diseases. He specializes in diagnostic tests to assess and evaluate heart rhythm disorders. In addition to performing ablations for AFib and other heart rhythm problems, Dr. Bauer implants pacemakers, defibrillators, and cardiac resynchronization devices.
We're very excited about the new EP lab at St. Mary's. It's been a significant investment on SSM's part, and we really worked closely with everyone in the design process in order to bring patients at St. Mary's a state-of-the-art electrophysiology lab. It'll feature a brand new biplane fluoroscopy system, which allows us to take X-ray pictures of the heart from multiple locations at the same time. It also allows us to do 3D reconstructions of the heart chambers and other structures that we need to take X-ray pictures of. And all of our other new technologies and techniques that allow us to really bring the best care for the patient.
For a referral to an SSM Heart Institute specialist, call 1-866-SSM-DOCS.